Blog Talk Radio.
Welcome to our program on Kardec Radio. And now, here's our host, Dr. Vanessa Anceloni.
Welcome, dear listener, to Kardec Radio. We are here live from the Chantilly studios at Kardec Radio, and we are happy to share with you that we have here with us today Dr. Emma Bragdon. She's going to be talking about many important and urgent things, amongst them how we can bring spirituality in healthcare, something that really makes us feel a whole being. We're much more than the physical body, and you know of it. So we're going to talk about this and much, much more. And we also have a special guest. Our dear friend Geraldo Lemos Neto is here with us in the studios as well. He is traveling from Brazil. He was visiting the Spiritist Center in Virginia, gave a lecture there about Andre Louis' works, and he's here today with us. So we are very, very happy. It's a special day for all of us, something really to discuss and share with everyone in your life. Let us not forget that this April, at the end of April, the last Saturday of April, the United States Spiritist Council is organizing the 8th United States Spiritist Symposium, a true opportunity for you to know new friends and also to mingle with those who are like-minded. And the theme of this year is the 150th anniversary of the Gospel according to Spiritism. Fascinating, lots of great speakers from the United States, everywhere in the United States. They're going to be there. It's going to be in Chicago, Illinois. If you want more information, just go to www.spiritistsymposium.org, and there you're going to find information about the registration, program, lodging, transportation, etc. Something not to miss, because the United States Spiritist Symposium is also where we talk about the latest advancements of the Spiritist science. Spiritism is a science that is complete in itself because it studies the spirit, its nature, its origin, and its destiny. Allan Kardec, the codifier of these teachings, he put together these beautiful teachings, in a beautiful little book that you can acquire at ediceiofamerica.com. Just go to ediceiofamerica.com and get the one that says Spiritism in its simplest expression. A great way to begin your studies. Also, if you want to give it as a gift to those in your life who are willing to understand more about what you believe, what you know, your way of living, there it is. It talks about immortality, something that is beyond religiousness. It is about our true selves and our connection with God and other minds, not only on the earth, but everywhere in different dimensions. And talking about dimensions, talking about the fact that we are more than a physical body, what about when we need health care? When we go to a doctor and we have a headache, and the doctor simply observes the physical body, but forgets that you are an emotional being, forgets that you are a spiritual being. You go home, you take Advil or something else, but the headache doesn't go away. Exam after exam, you find out that science is telling you you have nothing, but you do have something, a headache. And it bothers you. Some days you can't go to work because it's stagnating. And then you start becoming depressing, etc. This is one of the stories that we actually came across, very real one. The end is not very happy, and we would say, what can we do to improve our health care? Are there things we can do ourselves, either as patients or as healthcare practitioners? certainly there is this and much, much more to do. Spirituality is probably the solution. And Dr. Bragdon is here with us, and she's going to tell us this and much, much more, especially about this online university she created to disseminate and train people on this very different approach. It's a shift in the paradigm in science, in healthcare, something that is most needed nowadays and forever, and something that is already happening in Brazil, in many places, and must come true in other places like the United States, Canada, and everywhere else. You can talk to Emma Bragdon if you want live today by calling our toll-free number 858-769-4705. She'll be happy to talk to you, and I will do too. If you don't want to call, you can email us at kardecradio@gmail.com or go to the Blog Talk Radio chat room at Kardec Radio, and we are there live listening from you. We want to know, what are you thinking about it? Is there something else that you can do? You can be an advocate for the cause as well. Well, to kickstart the program, we're going to recall that Allan Kardec himself, in the book, the Spirit's book, he talks about the fact that when we get to know of the reality of the Spirit, we're going to change the way we treat patients who are ill. Of course, he used other words, but that's pretty much the concept. That was in 1857. Allan Kardec was this visionary mind ahead of his time and ahead of our times as well, because Spiritism comes for the future. What we're studying today is for the society that is being transformed. Right now, if you are thinking that it's impossible, let us listen to Joana de Angelis' words when she says, don't let yourself be deterred, and let us march towards this shift in our health care.
Let not yourself be deterred.
Slander affected you because you paid attention to it. Calumny harmed you because you gave importance to it. Discord has upset your ideals because you paused to consider it. Hatred has embittered you because of your hurt pride and inflated self-esteem. Dispute hampered your work because you let yourself be entangled in it. Doubt nestled in your mind because you kept yourself in aimless idleness. Accusers live within a low vibrational level. To give them too much attention in order to attract their sympathy is a waste of time. You expected a general approval but did not care to consult with God. If you are striving to do good and others accuse you, if you are generous but people call you a spendthrift, if you are humble and people say you are stupid, if you have self-discipline and people judge you strict, if you meet your duties and others curse you, if you bow in prayer and try to act according to the gospel and people despise you, do not consider their opinions, because that is not what the Almighty Father thinks of you. Do not let other people's opinions deter you. Do not allow yourself to be either afflicted or conflicted by the contradictory opinions of others. Accept only the inspiring suggestions that stimulate your spiritual progress. You will always meet with those who are productive and those who complain, accuse, criticize, and harass. Such people come and go and are soon forgotten, but the work done by those who dedicate themselves to do good will last forever.
We will return to our program after these messages.
Getting to the Light, Spiritist Therapy for Discarnate Spirits is a small book that offers guidance to Spiritist practitioners and Spiritist counselors. Purchase your copy at www.ssbaltimore.org.
Nourish your soul with Kardec Radio.
If you missed out on a previous shows, no worries. We have an on-demand section of all previous shows and interviews. Go to our website at www.kardecradio.com.
Spread the word. Kardec Radio, to learn more about Spiritism.
Help prevent suicide by reading and sharing these books with others. 2 great books are available to help in this Kardec Radio campaign to prevent suicide. Suicide, All You Need to Know, by the international Spiritist speaker Richard Simonetti. You can buy your copy at www.roundtablepublishing-uk.com. Also, Memoirs of a Suicide by the medium Yvonne Pereda. Buy your copy today at www.ediceiofamerica.com.
Kardec Radio, live every Saturday at 11 a.m.
Kardec Radio now offers more programs during the week and weekends. Every Wednesday at 5 p.m. Eastern Standard Time, you can follow the beautiful program God at Home with Francisca Kranz and the British Spiritist community. They will brighten your days by doing a God at Home meeting wherever you are in the world, while teaching you how to do the same in your own home with your family and friends. Every Thursday at 7:30 p.m. Eastern Standard Time, you will hear incredibly inspirational Spiritist talks directly broadcasted by Spiritist Network. They will be true educational moments to carry out to immortality. Every Saturday, live interviews, Bridging Health and Spiritism with the host Dr. Vanessa Anceloni. You may ask questions to the interviewed guests by calling 858-769-4705. And every Sunday, tune in to Spiritist Awareness at Kardec Radio. You will hear a series of segments on a diversity of Spiritist topics. Kardec will broadcast the Spiritist Moment with Kirsten DeMello, the reading of the Spiritist book by John DeRosa and Steve Shepard, Spiritism in Your Life with Drs. Marco and Joyce Magalhães, Spiritism and the Gospel with Luis Sergio Marotta, Spiritist Education for Youth and Children with Bernadette Leal, Spiritist Music with James Marotta, Neuroscience and Spiritism with Dr. Vanessa Anceloni, and many more segments coming soon. Enjoy it all and nourish your soul with Kardec Radio.
And now we return to our program.
Dear listener, we are here live at the Chantilly, Virginia studios at Kardec Radio, and we're talking about the most important topic, spirituality in healthcare. We need to meditate about it and to really bring forth a shift in the paradigm of healthcare. And, you know, there is an expert in the field who is leading this transformation in so many ways in the United States, Emma Bragdon. Dr. Bragdon is here with us, and we are happy to have her here again at Kardec Radio, but today to talk specially about this topic. Academically speaking, she has a PhD in transpersonal psychology from the Institute of Transpersonal Psychology, recently named Sophia University. She also has advanced training in process-oriented psychotherapy, neuroration therapy, breath work, past life regression, bioenergy therapy, and developing intuition. She has written books that talk about spirituality in healthcare, a book about John of God, but especially a textbook on spirituality in healthcare. And she's going to tell us today about something that is very important she has been doing, which is the online university, which is named Integrative Mental Health University. Emma Bragdon is here with us, and we are happy to have her. Thank you so much, Emma, for being with us again at Kardec Radio.
It's a privilege and an honor. Thank you, Vanessa. I'm happy to be here.
It's wonderful, Emma. We are talking about such an important topic nowadays, especially in the United States where we live. If you are mentally ill, we would say you have two problems, your mental illness and how you're going to be cared for. Would you agree with that statement?
I absolutely agree, yes. Yes, and also how are you just going to get information about the right kind of care? I would add that to the list or say that it's a very important component.
Because the resources are not visible?
People can go online and they can search. For instance, if they're given a diagnosis or if they think they have a particular mental illness, they can go online. But most of what we find when we go online or Google a mental illness about ourselves or our children, for instance, we can come up with information that is most oftentimes sponsored by the pharmaceutical companies, even though that isn't sometimes obvious. It is often the truth. And so people begin to get this idea that any kind of mental instability must be related to some biological disorder. In other words, in the way we commonly speak about it, we've got a broken brain. And then they think, oh, okay, then I need some kind of medication that's going to fix my brain. And then they go in that direction of medication for themselves and or their children. And it's most of the doctors who are in practice today have been trained in that same paradigm. And so people can go to just their family physician and ask for a prescription for a particular pharmaceutical, and the doctor is quite likely to comply. So people are not aware of the full range of options for treating mental illness, and they're often not aware of the grave problems that we have with that paradigm of care. And so I founded and now direct this online university, which is independent of special interests, to give information about the full spectrum of not only treatment but also diagnostics, so they can be more informed when they make choices about caring for themselves or caring for their children or their parents in elder care, etc.
So Emma, the thing is, in the United States and in most parts of the world, mental health care in specific is treated with pharmaceutical remedies and therapy as well. But mostly it's a pharmacological approach.
Yes.
But we are not saying that there is any bad in using this pharmacological approach, right?
No, I don't say that there is something always bad about it, but there is research that's been coming out that definitely shows that the pharmaceutical companies have not completely represented accurately what their research has found. And thus people are unaware of some of the problems that can come. Now, that's not to say that, I'll say it in a positive way. There are some people who are very much helped by taking pharmaceutical medication, especially for the short term. It can be extremely helpful and the most compassionate way to go to help ourselves and our children. However, when we get into long-term resolution of a problem, there are really grave issues in long-term use of pharmaceuticals, and people have difficulty finding out that information. Yeah, I think one of the most impactful experiences I had in the last year was in September. I went to a conference in the nearby Dartmouth University, which is very well known for its superlative medical school, and hospital, and they had participated in sponsoring a conference for physicians on overdiagnosis, meaning that they're aware that people are in a position to be overdiagnosing, especially mental illness, and also then perhaps using pharmaceutical medication too loosely and too abundantly. So it's very much part of the conversation these days. And the Cochrane Collaborative, which is very well known as an international research organization putting out systematic reviews that help people become informed about evidence-based healthcare. One of their co-founders recently wrote a book called Deadly Medicines and Organized Crime, How Big Pharma Has Corrupted Healthcare. And I haven't read the book myself. I have listened to the author speak, and he is bringing in a perspective that is not very well known, that is important. But I would agree with you that there are some people who are very much helped by the short-term use of pharmaceutical medications. So I'm not anti-psychiatry or anti-medication. It's just that it gives us too small a window into what is needed for mental health care, meaning treatment of problems, but also for optimizing health care, because ultimately that's where we all want to go. We want to have the best kind of mental health that's possible. And it really is an illusion that the pharmaceuticals are healing. They are making it possible for us to function despite our symptoms.
The problem, Emma, is that I'm sorry to interrupt you, but it's foundational because it's based on the principle that we are a physical body, and as such, we are limited to more material approaches, such as the very approach of using pharmacological remedies. And if we change the paradigm by really assuming that there is more than the physical body, then certainly we'll need more. So do you think we can get to the shift in the near future to really approach healthcare in a new way, especially in the United States, based on your observations and your research? What do you think?
Well, I'm really pleased to see how much Reiki has been accepted in hospitals. And even in our nearby Dartmouth Medical School hospital, they allow the Reiki practitioners to come in. And so energy work is beginning to be more widely accepted, and it's become well known, especially in palliative care, helping people who have a lot of pain or who are close to death, who are terminal and are undergoing a tremendous amount of emotional pain, sometimes a lot of fear, as well as physical pain. So it's becoming well known that the energy work can be extremely helpful for people. And I've spoken to a lot of nurses who say that they're often called in to do energy work on the patients by doctors who have been quite conventionally trained. But the conventionally trained doctors, who do come from a more materialistic approach, are really recognizing that the energy work is making a big difference. So they're calling on the nurses who do it, or the people who are coming from the outside, to do this kind of work, and happy that they're there, and the patients are happy that they're there. So I think there are some inroads that are going on, and then, of course, there are more integrative mental health clinics, not a lot of them, but certainly more clinics that have on a more collaborative approach to their offering of mental health care treatment. And they have in their group people who are doing energy work. and also people who are teaching meditation, and in some cases teaching meditation to children as well as adults, because it's become quite well known that children are settling down more and able to put their attention on their work if they've done a little bit of meditation, mindfulness meditation. So I think there's a more openness that's going on in our healthcare system to recognize that this kind of work that has to do with consciousness and expanding awareness, and recognizing that there may be something that is invisible, or at least the materialistic point of view cannot easily measure it or see it, but there's something there that can really create a difference that's very palpable by patients, as well as measurable in terms of cutting down on the amount of time people need to heal from surgery, or making it possible for people to be more well prepared for surgery and thus have a better outcome. So I think there are inroads, but we are still quite far away from bringing in such concepts as reincarnation and karma into our mental health care system. So we have to recognize that there are some individuals and some groups that are making that kind of perspective available to people so they can learn from it, and so that they can orient their own health care maintenance to those kinds of concepts. But it's quite rare still from my perspective. And
Emma, go ahead.
I just wanted to say that I think that's one reason that the Spiritist centers in the United States can play a very important role, because they are set up and organized to offer classes and books and educational opportunities for people to look at this other perspective. And you, through your radio, are offering and encouraging people to look at these books or attend symposiums. And that helps people to really broaden their minds about different ways of approaching healthcare. And then they're more likely to go to healthcare providers who will accept their point of view and work with them with that point of view.
Yes, you're so right, and thank you for mentioning that. Emma, we're going to give a short break. When we come back, we have a listener that has a question for you, and we also want to talk about Brazil as probably the role model for mental health care with the spirituality in its approach, okay? After the break.
Okay.
We will return to our program after these messages.
New release, Liberation. In this compelling narrative, Andre Luiz emphasizes the work of high-order spirits in the effort to convert the spirit Gregorio to the good, an effort that culminates with the unforgettable re-encounter with his mother, herself a highly evolved spirit, wherein he surrenders to the irresistible call of love. The book also contains information on how unhappy spirits act as they try to involve incarnates in their wiles. The spirit author tells of the intercession of high-order spirits on behalf of human beings, demonstrating the divine compassion that grants to all the blessed opportunity to free themselves by means of study, labor, and persevering service in the practice of the good. Buy your copy today at www.ediceiofamerica.com.
Spread the word. Kardec Radio, to learn more about Spiritism.
Want Spiritist books for your children? At Edicei of America, you will find a collection of them. From the best-selling book, Our Father, in which the Spirit Mei Mei through Chico Xavier brought countless poems, stories and folk tales based on the Lord's Prayer, to the beautiful and educational collection by the author Adelison Sales on Back to School and many others. Buy your copy today at www.eddiesaveamerica.com.
Nourish Your Soul with Kardec Radio.
If you missed out on previous shows, no worries. We have an on-demand sections of all previous shows and interviews. Go to our website, www.kardecradio.com.
Nourish Your Soul with Kardec Radio.
Spiritism for Everyone is the live web study meeting and educational program of the United States Spiritist Council. This year, in commemoration of the 150th anniversary of the Gospel according to Spiritism, the Spiritism for Everyone program will present an in-depth study of this remarkable book. Join us every Wednesday evening through the web from any computer or mobile device, no matter where you are in the U.S. Spiritism for Everyone is free, open to all, and requires no registration. For more information, go to www.spiritist.us.
And now we return to our program.
We are here talking about spirituality in healthcare, especially mental health care. Because as you know, dear listener, if you have a mental problem, mental illness, depending on where you are in this world, you are in trouble, unfortunately, unless you have spiritist centers that are also helping you and good healthcare practitioners. But in general, our system is very materialistic and discard the other parts of ourselves, including our emotions. We will not even say the spirit, but our emotions are also discarded in great part. So there is another way of approaching it. And Dr. Bragdon is here with us today. She's the founder, executive director of the Integrative Mental University Online. She is here to discuss about this new approach, something that is already happening in other parts of the world, such as Brazil, and shall sooner than later, hopefully, be spread out to other countries in the United States and around the world. And she's here discussing this very topic about how we can shift it and be treated or treat our patients in a much more complete, holistic, integrative way. It's beyond just a new agey approach. It's about the reasoning of our minds telling us that we are more than the physical body. And we would like to start, Emma, this conversation of this part of our interview with a question by Jay. Jay is here. Hi, Jay. Thank you so much for being with us at Kardec Radio. Jay, where are you again? Are you in North America?
Yes, I am in Canada. Thank you.
In Canada. Thank you so much, Jay, for being with us. And please ask your question to Dr. Bragdon.
Yeah, I just wondered, how is, Big Pharma perceiving what's going on with putting spirituality into medicine? I just wondered what your perception or what you heard about that.
You're asking me what I've heard about putting spirituality into medicine?
Yeah, or into
did I get your question?
Or healing? Yes, into healing, because I just wondered what the Big Pharma groups think about that, since it basically controls healthcare in general. I just wondered what do they think about that?
Well, it's hard to measure what they think about it. Of course, the big pharmaceutical companies are in business to create money, and so it's in their best interest and the best interest of their investors if they persuade more people to look at things from a materialistic point of view, and therefore look to the drugs and purchasing drugs, using the drugs for a longer period of time, because that gives them more money. So I would imagine that the idea of spirituality having an impact on mental health is not something that they want to pursue. But I think those people who are oriented more towards research and really looking deeply into what is it that works and helps people the most are bound to recognize that spirituality is having an impact on mental health. So one bit of research that I've really appreciated was done by Norm Shealy and Dawson Church for a book called Soul Medicine. And they also did a meta-analysis and recognized that people who participate in meditation and prayer actually have less depression, they have a stronger immune system, they are much less likely to use drugs, meaning recreational drugs, or tobacco or alcohol, or abuse alcohol. And they tend to have a longer life and be more content, more satisfied, have more well-being. So with that kind of research and meta-analysis being done and books being written about it, more and more people are becoming aware that spirituality and spiritual practices have a very important role to play in health management, as well as and the fellowship that we get from being part of a spiritual community. And this is one place that I think Spiritism is really a star, because they recognize that fraternity, or fellowship as we would say in English, is extremely important for people, and they need to be together to discuss things like why are we here and where do we go after death, and really sort out their own personal sense of mission. Why am I here? Not just why are human beings here, but why am I uniquely here? And so sorting out questions of meaning and purpose with people who are in spiritual fellowship is a very important component of coming to terms with oneself and finding more mental health and more stability. So fortunately, this is being written up and is becoming more well known. But whether it can actually compete with the commercials of the pharmaceutical companies is another matter. Does that answer your question?
Yes, I do. Thanks so much. If I can ask another question, is it possible?
Sure. Go ahead, Jay.
I find that the healthcare system is more geared toward keeping us sick, and the more spiritual stuff that we put into our, healing or spiritual healing is more about, basically resolving the issue for good. I just wondered, I find there's a clash there. If you try to involve spirituality into our current healthcare model, it kind of doesn't work, actually. Just wonder what your thoughts about that.
Well, I think we agree that the current healthcare model is based very much on pharmaceuticals or interventions such as surgery, if we include a larger healthcare model. But the people who are working, or let's say individuals who are working within that model, are becoming more and more educated about the positive impact of meditation, prayer, energy work, and so they are inviting a different paradigm to come in to certain clinics and certain hospitals. But I think it depends a lot on the people within those hospitals and clinics, or private practices even. It depends a lot on them, whether they've exposed themselves to this wider arena and this larger paradigm. We can't assume that everyone is who is practicing medicine or a mental health care provider is keeping up with current research and is aware of the tremendously positive impact that spiritual practice and some spiritual philosophy can have on promoting and optimizing mental health. So it really depends on individuals becoming educated and changing the system, I think, from the inside, as well as educators becoming more cognizant of the positive impact of spirituality, and then training doctors, medical school students, so that they become also more aware of it and can carry it into the practice that they create after their education. And luckily we have some real leaders in that area that are bringing spirituality and the positive impact of spirituality into mental health care in terms of preparing students. So that's being done especially at the University of Arizona under Andrew Weil, and also George Washington University under Christina Puchalski. And these leaders are also making available sources of information. So they have resources available for people who want to really look into this area. And it's a tremendous help in terms of creating a shift in the system as it is. But again, money speaks.
Yeah,
and
that's right.
Yeah. And so we have to be aware of that and the commercialism behind the pharmaceutical companies, and that they have a very powerful voice because of the money they put behind the commercialism.
Mm-hmm.
But still, there are highly ethical people who are deeply dedicated to expand the paradigm, and it is going on now, and we can celebrate that.
So thank you so much, Jay, for asking these questions, and thank you for being at Cardiac Radio today, okay?
Yeah, thanks, Emma. Thanks so much.
You're very welcome.
So Emma, when we talk about healthcare and the shifting paradigm, it's already happening in Brazil, and you have been organizing trips for health professionals to Brazil. Can you please tell us what is happening in Brazil that can really be modeling for us elsewhere in the world?
Sure. I do want to say that I was fortunate enough to be able to spend 6 months of every year between the years of 2001 and 2012. I was in Brazil and had the opportunity to travel widely and go to many Spiritist centers, and also visit several of the Spiritist psychiatric hospitals, where I was honored to be the guest of the administrators who gave me an inside view into what was going on both at the Spiritist centers and the Spiritist psychiatric hospitals. And in one case, I've been asked to be the ambassador of one Spiritist psychiatric hospital in Goiânia. And so that allows me to bring groups of health providers to the hospital where they can meet the psychiatrists, the nurses, and as well as the mediums and intuitives who collaborate with the health providers, creating a very expanded treatment paradigm. So I'll describe that a little bit if you'd like.
Sure, please.
Okay. What has impressed me is that in walking into the Spiritist psychiatric hospitals, I experienced that they were very much in line with conventional treatment. In other words, they did a registration and assessment of a patient in the same way that the hospitals would that are more well known in the United States. They also have a whole supply of the newest psychiatric medications if they're needed, and they also advocate the psychological treatment through psychotherapy, as well as different forms of physical exercise and being out in nature that can also have a tremendously positive impact on healthcare. But when a patient elects and authorizes to also have the Spiritist treatment within the Spiritist psychiatric hospital, then they also have access to the energy healing work that can be done through the healers who make themselves available to the patients. They can also get diagnostics by the medical intuitives who are available, who come from the Spiritist centers to help the patients. They can also have access to water that has been blessed, prayer, Spiritist fellowship, again with people who've come in from the Spiritist centers to offer support. And in some cases, when the patients are ready, they're encouraged to study spiritual texts or join study groups to better understand the existential questions we all have to come to terms with. Mm-hmm. So they're much more apt then to see that the mental disturbance that they're undergoing is a step on their journey of spiritual evolution, and that they can, in fact, gain a tremendous amount of strength from a greater connection to their own spirit, as well as to the spiritual guidance that can come through spiritual books, texts, as well as fellowship with others who are deeply dedicated to their own spiritual evolution.
It's fascinating, isn't it?
Yes, and I know you know of this very well. I appreciate your letting me speak about it. But I was, as someone who was born in North America and doesn't have the wealth of understanding you do, Vanessa, from being 5 generations of Spiritists in your family, I was just so profoundly impressed with what was being offered in the Spiritist psychiatric hospitals, because it's such a more expanded view than we have, and yet it doesn't cut off the understanding that modern science has gained by any means. It simply adds to it, or it adds a spiritual component that complements what we already know from Western medicine.
Exactly.
So I agree with Marlene Nobre, a fabulous physician who has been so instrumental in helping with international education, that this is a true integrative model, because it deals with the biology, it deals with the psychology, it deals with the social stresses that can take a person into a mental disturbance. But it also really brings in the spiritual component, helping us to see that the problems may have actually started in a previous lifetime, and helps us to really embrace the fact that we are all on a trajectory of spiritual evolution that takes us in and out of lifetimes and may go on for, well, it's hard to say it in years, how many years, but a very long time.
Yes, and when you talk about also entities that can create a spiritual disturbance, which we call obsession, and no pharmacological approach will ever get it resolved. So you're right. There is this model in Brazil, and hopefully, we are going to change it elsewhere in the world, especially with your great leadership. Emma, we have here with us Geraldo Lemos Neto, who is visiting for Spiritist work, and he is ready to ask a question to you. Okay?
All right, please.
He was good friends with Chico Xavier. He wrote books about it, and he's the director of the Casa of Chico Xavier in Pedro Leopoldo. Geraldo, thank you so much for being here with us.
Thank you. Hello, Emma. How are you?
Hello, Geraldo. Very nice to meet you.
It's a pleasure to listen about your work. Emmanuel, through Chico Xavier, wrote in Brazil in 1952 that the mind is a living source of creative energies, that thought is substance, a measurable thing, that imagination is not a place of vague creations or uncertainty. Otherwise, it is the source of vitality, energy, and movement. Would you comment on that statement? Would you agree with that, with your experience?
Oh, well, that's a profound statement with many, many aspects to it. And it's certainly broadening to even contemplate what you're saying. And yes, first of all, yes, I would agree with everything that you just said. And it takes us into a realm of understanding the mind that is quite different than what most people have been trained to understand in the North American culture. So we are so, I would say, obsessed with science and the measurements of science that we've come to believe that if we can't measure it, then it doesn't exist. But what you're speaking of, and what Chico Xavier was not only speaking of, but what was a living example of, has to do with a mind that has immeasurable capacities, or capacities we have not yet learned to measure, and we're only beginning to learn to work with in a way that will positively impact our health. So I would say that everything that I've read about Chico Xavier, about him, as well as what I have read of his works, which has been all of his works that have been translated into English, and some that have been in Portuguese, he is an extraordinary leader in terms of assisting us to understand the mind in a more complete way, and also to help us to understand how to live. And he was such an example of generosity and charity, and so deeply dedicated to his own spiritual evolution and to assisting others. He absolutely deserved to be called a living saint, I think.
That's for sure, Emma. That's for sure. And Emma, we have here also Daniel Santos. He shared that Blog Talk Radio chat room. Thank you, Daniel. He says, let's keep in mind that there are different levels of treatment, such as physical, spiritual, mental, emotional, and these levels need to be addressed in order to have the integral healing. It can be a problem if you concentrate in one just aspect. And that's exactly what we're talking about here. Thank you so much for making such a beautiful statement, Daniel. Now, Emma, we'd like to wrap up this conversation by asking you to kindly explain to us about this online university you created and how it can help change this approach in healthcare, and especially in mental health care, by studying at your university. Please tell us how it's working, how people can engage, participate.
Okay, thank you. Well, I'll start by saying that the way they can follow through and find out more is to go to imhu.org. We are a not-for-profit organization. We have a series of courses we're offering, a blog, an article archive, and a faculty of 20 who are engaged in creating these online courses. All of the faculty I've selected myself, and they have an integrative approach, meaning they understand very deeply that spirituality has a place alongside the biological, psychological, and social aspects of work in mental health care. So one of the easiest ways of exploring what we have to offer is to go online and take a look at our a good look at our website. But there is a course that is a very short course, which is on spirituality in mental health care, and it is a webinar that I gave that really goes over what is available in Brazil in Spiritism and at the Spiritist psychiatric hospitals in particular, and how we might bring that into what we have in the United States in terms of shifting the paradigm. So that's one easy way to get into the course material, and I'm in the process of adding courses now each month, and also making it possible for people to get continuing education units if they're health providers, so that they can continue to fulfill what they need to do for their continuing education every year, as well as learn more about integrative mental health.
And your faculty is from around the world, right? You have people from Brazil, yes, England, United States, etc., correct?
Yes, that's right. That's right. But we did start quite recently, so people are just coming up to speed, and learning how to work with the software programs to create their online courses. So at this point, we have just a few courses available, but we have a lot in our article archive, a lot on our blog, and we have a newsletter that's sent out that helps people to become aware of what we are offering and at what time. So the other thing we have is an audiovisual library with over 34 different video interviews with me interviewing faculty as well as guest presenters about this more expanded integrative approach. So there are a lot of resources now online that can help people to understand a more integrative approach. And I'm, as you know from especially this interview, I'm very partial to what Spiritism has to offer, especially that it has this model that has lasted over 80 years that is within the Spiritist psychiatric hospitals. And but I don't believe that we in the United States are ready to completely bring such a model into the United States, that we need to work towards it perhaps and take it as a model or as a possibility, but it may not be something that we can accomplish overnight.
Oh, but, that's for sure.
Yeah, but the educational resources that you present and that are becoming more and more available in the United States, and including things like the Integrative Mental Health University, I think are all working together to expand the paradigm.
Yeah,
and that's
thank
good.
You so much. Yeah, that's wonderful, and we really admire the work you have been doing. We want to share, Emma, that to those who are in the New York City, I've got to know you're going to be at the Inner Enlightenment Spiritist Society on February the 25th at 7 p.m. For people who want to get a hold of Emma that day, please come to the center. It's www.innerenlightenment.com. It's going to be February the 25th at 7 p.m. Emma Bragdon is going to be there talking about the very topic of spirituality and mental health. And again, the website, emmabragdon.com, or the Integrative Mental Health University website as well, which is, again, Emma, can you repeat the website for the university, please?
Yes. The letter I, MHU.org.
Great. So, Emma, we wish you the very best in this beautiful work you're doing, and many blessings, because, as you said, it's not going to happen overnight, but as everything in nature, it's gradual. It is a sure thing, because we're evolving on the earth, as you know. We have come a long way, and things shall progress. Thank you again and again, Emma, for being with us at Kardec Radio today, sharing this beautiful news. We hope to have you back.
I enjoyed it. Thank you very much. I very much appreciate being with you. I wish you all the best.
Thank you, Emma. Thank you. So, dear listener, we could talk for hours and hours here because Dr. Bragdon has a lot of work she has been doing, and she has written 7 books, amongst them a textbook that is really fascinating. You can read about her in the website at emmabragdon.com. Get to know of it, share with your friends, especially those who are working in the mental health care field. Now, we would like to share with you that the latest issue of the Spiritist magazine has beautiful articles talking about how science is validating the very statement in Spiritism: without charity, there is no salvation. It's the project It's Good to Be Good by Dr. Stephen Post. And did you know he's going to be with Divaldo Franco in Washington, D.C. at the end of March? At the end of March, the Spiritist Society of Virginia, together with the Spiritist Society of Baltimore, the Allan Kardec Spiritist Society of Maryland, the Spiritist Society of North Beach, the Bezerra de Menezes Spiritist Center are putting together the efforts to coordinate a beautiful event in the capital of the United States at the National Museum of Women in the Arts, at New York Avenue in Washington, D.C. It's going to be Thursday evening at 7 p.m. You don't need to register. Why? Because it's free admission. Believe it or not, but the world is really good. Really good, and all you need to do is to be good and do good as well. We will soon release the web page so you can get to know more information about it. Divaldo Franco is coming back to the United States. And if you want to read about these scientific advancements, just go to thespiritistmagazine.com, and we have beautiful articles. You can read it on PDF, digital form, or print your copy at HP MagCloud. For now, we're going to wrap up the program by thanking God. It's our prayerful moment. Let us pray together, because prayer is therapy as well. Let us raise our thoughts and visualize much light of discernment enveloping hospitals around the world. This light traveling to every hospital, enveloping its practitioners, patients, administrative staff, making everyone realize about the true nature of ourselves, our spiritual nature. We then raise our thoughts to our Creator. Dear Mother, Father, God, in our materialistic point of view, we're childish. Help us, please. Grow stronger in our discernment and reasoning. And reach out to those who are in need of healing, of harmony. We ask you kindly to bless the works of Dr. Bragdon, who has been bringing forth these wonderful efforts that shall make a difference in our lives. We pray in this program especially for those who are suffering from mental illnesses. in this type of adversity. May they find a helping hand, a patient shoulder to lean on and recover, reharmonize themselves, knowing that they are loved by you, and soon will find themselves out of that imprisonment with a lot of hope in our hearts. We thank you for this moment, and so be it. Dear friend, something we need to talk about is mediumship, because lots of people are in psychiatric hospitals because they have mediumship and are not working on it. Sometimes they have no clue whatsoever that they are mediums of spirits that are putting themselves into that mental instability. This and much more we're going to discuss in a week from today, when Jussara Korngold, the Vice President of the United States Spiritist Council, is going to be joining us to discuss about mediumship in Spiritism, because mediumship is not a belonging of Spiritism, but it is studied and practiced in the framework of Spiritism, and in such way it can transform lives. We're going to talk about this and much more in a week from today. Don't forget, tomorrow we have Spiritist Awareness at 8 p.m. on Wednesday. Francisca Kranz, Mackenzie Mayer are going to talk about God at Home. And on Thursday, Daniel Santos from Spiritist Network is going to release another beautiful talk amongst all the many talks he has recorded in his beautiful network, Spiritist Network, on Thursday at 7:30 p.m. Right now, we wish you lots of blessings and a lot of joy. Let us be hopeful. Keep sharing the good news that Kardec Radio is here to nourish your soul.
Thank you for listening to Kardec Radio, broadcasting live every Saturday morning at 11 a.m. Eastern Standard Time. Email us and share your comments at www.kardecradio.com. Until next time, we wish you many blessings.